So I felt like my relationship with Jay was really nice. It really showed me a different type of person he was when I was here. And I was able to have like both aspects of the hospital and the birth center. But I felt like at the birth center, it was just so us. And I was able to see like a different side of him, like more nurturing, more caring, more in tune with what like my feelings were. And it just like really built from there. Like now that I have like a 1.5-year-old, it's nice to know that that's there. But do you feel like a birth center can help build a relationship?
I mean, I wouldn't use the words in those terms. I mean, because it depends on what the foundation or the basis of that relationship was before. So, it's the same thing that when you decide to bring children into a relationship, a lot of people might look at it as this is going to be the glue that keeps us together, when it actually is the C4 that can blow it apart.
Yeah.
So what I would say when it comes to birth center, that if you are in that mindset of we are doing this together, we are partners in this, we are bringing a child into the world, we are growing and expanding our family, you might appreciate things that you wouldn't have seen your partner if you hadn't seen him in that light, both from the maternal and the paternal side. I think a birth center might kind of glow up that whole situation before the baby was born. And then you kind of see that nurturing side, like you described. You kind of see that hands-on, that the interest, that shock, that awe, the surprise, that real, like, I'm here, I'm with you, I'm into you, this is amazing. What we're doing is so important. And I think it does kind of make a difference when you're dealing with that kind of an intimate setting.
And Michelle, you visit patients prenatal and you visit them at home.
Yeah.
You're there for the labor and postpartum. Like, do you see that trait have you ever seen like that growth?
It's definitely an inherent kind of part of the intimacy that Dr. P was talking about. There's a sense of awe that the partner has of what, the wife or girlfriend has just done. And so it builds at home as well. Maybe sometimes that support is just extra. Oh my God, look what she just went through. Let me make sure I'm there for her. So I definitely do see like it kind of, crescendo a little bit and get a little more intensified. I know personally, it was definitely a space for me and Brent where it was like, I'm a very independent person. And to have to be vulnerable first and to know that person is there for me, that I can fall on, was like really awesome. Like I didn't expect that I would need that. Mm-hmm. And that was there. And I definitely see that. And we talk through it with, families, who are always like, I don't know what to do. I'm just a guy, like that kind of thing. I don't know how to help her. And I'm like, just be you, just love her.
Yeah.
And when you do that, you're supporting her.
Do you see that a lot when you like do your prenatals and then you see them here for when you deliver here at a birth and you're like, oh, this is one of my patients says, oh, look at the husband just, it's that. Okay, girl, I see you. Like, do you see that a lot?
I do. I feel like sometimes they need a little push because they're like in the corner, like, oh, let me get out your way. I'm like, no, let me get out your way.
Yeah.
This is your birth experience as well. So teamwork, and I get, like they said, seeing your partner in that vulnerable state kind of changes your perspective, because I feel like to men, like they know women have babies. Everyone's been doing it for centuries.
Yeah.
Intellectually is there.
Yeah. But until you've been in it and you're like, wow, like this is what you go through, then it's like a sense of more appreciation, like, yeah, definitely bringing life into this world. I felt like that's what Jay said to me. He was like, I just saw how powerful you looked in that moment. And I was just in awe, and I just needed to be there and do whatever it needed to be done at that moment, because it was just like you looked either just not helpless, but you were just done. You felt, you looked defeated, and I needed to be able to support you and all that. And it was just such a different side that I appreciated. Not saying it's bad, but it's just like, oh, look at her.
And they step up to the plate.
It's a big deal. It's a big difference.
It is.
Yeah, that should be a little bit of a segue to let partners know that it's, even if you don't know what to do, just being present for your partner is most important.
But not being present in, hey, I'm in the room.
No, not just like, oh, I'm in the bed and I'm not buying counting family members and in and out. It is present, meaning your presence and with intention.
Yes.
You're
be here with me.
I'm here. I don't know how to help you. What do you need right now? I'm hot. Oh, you're thirsty. And just a simple, cup of water.
Yeah.
Let me get you something to drink to sip on a little bit. Those are the things I think that they recognize, that even though they're like, I could have taken the class. Michelle prepared us for everything, but it kind of went right up. And
It's like taking initiative of doing like the golden hour, of like from the skin to skin with it. Like, I want that. And then I was like, okay, now I can breathe. I can kind of go to sleep for a little bit while he has that skin to skin. But it's just the initiative of taking those little steps, and I want to try and do and help, and especially during postpartum. But
yeah.
I thought that was a good question to ask you guys. Call out the toxic rules that are so ingrained in society. Ready? Go.
You can't move in labor, or you can't push in any other position than in your back.
Ready?
Can't eat or drink.
Can't get those. Sorry, we're close to that edge.
It was there.
It was. She was like, I had. It's there. Okay.
Any other ones?
Yeah, positions, movement. Are you sure you don't want an epidural?
Yeah, that's a big one.
Yeah.
That's a big one.
Are you sure you don't want why?
Well, because, look, labor looks different for different people to different people. Meaning how either the person taking care of you might perceive labor and labor pain versus the person who might be in labor and how they are managing at that time. Perception can alter that perspective. And so, I don't say that as the discredit or judgment to the individuals in the health field. But, people are like, I'm here to take care of my patient. I want to make sure my patient's well taken care of. If they see them in pain, they might be thinking, what can I do to help you get out of this pain? But if you have a mom who's made very clear, but I want to try to do this without much intervention, I'd like to refrain from the epidural at this time, even if she's manifesting certain behaviors in that moment when it comes to how she's managing her labor pain, the person who's caring for her might say, well, she looks like she's really uncomfortable. Let me see what I can do to offer. But what you're essentially doing is kind of, setting them, it kind of doing a little bit of a setback, and it can be almost defeatist because they're like, I don't want that at this time, and I'd like not to be offered. And some moms, when they get to the point where they're educated enough or equipped with the knowledge of being able to say, please do not come into my room asking me if I want an epidural, because if I want one, I'll let you know.
Yeah.
But it's just, again, it's not a bad thing when you're saying, I just want to make sure you're okay and I want to take care of my patient. That's okay. But when it comes to being able to respect the mom's wishes to do that, sometimes some people just go, it's just easier. And I said the other side, it's easier to get the epidural and then the patient's kind of there. Mm-hmm. It's less work to manage the patient.
I was talking to Shadira earlier, and I was telling her the difference that I felt with contractions without PIT and with.
Yeah.
And I was telling her that was a wild ride. I couldn't take I came into that hospital like, don't you talk about an epidural. And they were like, if you want one, it's here. I know you want a holistic birth. I was like, shh, you shut your mouth when you talk. And he gave me, I was like, where is the doctor? But those contractions are, they really are, they're very powerful.
It's not your
Yeah.
It's not your oxytocin. It's a synthetic oxytocin flowing through your body. You're going to have a different response.
And then I did get the epidural, by the way.
Yeah.
Yeah. And then it wore off. And I was like, what?
Get me out of this baby.
But yeah, okay. That's cool. That's cool. How do you think we can lower the C-section rate in New Jersey?
That just kidding. A really loaded question. And for me, I think lowering the C-section rate is actually paying attention to physiologic birth and understanding, again, what a person wants, what they're capable of doing, and giving them all the tools that they need in order to succeed in that space. And there's a lot of hyperbole about what a person can't do, what they shouldn't be doing, and that can lead down to the road of C-sections. It's an easy out in a lot of ways. And I don't say that lightly. I know that cesareans are definitely needed in a lot of medical cases, but I think we're overusing them.
Yeah.
There's an awful lot of unnecesarians. Okay.
Unnecesarian?
Yes.
I like that.
Yes. But yeah, I think really just figuring out what that person's birth plan is, honoring it, and doing everything you can to make sure it happens. I mean, like, I'm gonna okay, this isn't blow up Dr. P spot again, but it is, because when there's a person and she knows that this is not their plan, this is not what they want, and there are obstacles in the way in front of them to getting that, and she's like, she has these real come to Jesus moment. Look, yeah, this is what you want, right? You know, and it's like, let's do this. I know you can do this. Let's go through it. And whether it's an epidural, whether it's a C-section, whatever it is, and if that she knows that her patient wants a specific thing, and of course the allowance to change their mind, but it is that support. And I just don't think that a lot of people are supporting their patients and their choices.
Oh, absolutely not. I feel like I've seen doctor's office that are factories that it's just like not even 10 minutes in your room. Like, you don't know your patients well enough. And I understand, like, when you do have a lot of patients, it's hard to know all your patients. But when you go in there, this is our moment. And I have been in places where it's like, hey, how you doing out? Like, so you don't even have that quick relationship or rapport for then my birth plan. It's going to be a joke because it's like, out.
Particularly in a multi-practice, right, where you're seeing so many different providers. Everybody has their favorite provider that they want, and then that one provider that they didn't really spend a whole lot of time with,
The one who shows
is the one that shows up to the birth. And so there isn't any of that, just personalization with regards, just more, it's more perfunctory. Like, yeah, this is what we need to do. We're going to get your baby out. You're going to be okay. Sorrows, blessings. It's just that very kind of
unnecesarian.
But it's unnecessary. I love that word now. I know. I just love that. But for me, being that, sometimes Shadera and I take care of patients that are not even originating from the practice. Mm. If they happen to be, let's say, another home birth midwife that we might be, collaborating with, and that patient needed escalation of care in a hospital setting. In that moment, even if I have not laid eyes on this patient before, my goal going in is she's my patient. And I'm going to give her the same treatment the way it was a patient who originated from it.
And that's why you're different.
Oh, well, absolutely. No.
I didn't mean that to try to put myself out there. That's not it.
It's not that's on that.
It's rare to find.
It is literally the reason why. Amen. We adore you. That's it.
No, okay. No. I just
necessary.
I thought because I heard that. I don't know. It's all the unnecessary. Yeah.
How do we crush negative self-talk during a birth?
I love the word to crush, because that's exactly what you have to do. That's exactly what you have to do. I'll give an example.
It's hard.
I'll give an example. We had a patient that was at the birth center who, she got to fully dilated, and this was recent, and she was clear she didn't want an epidural, but she was more clear that she didn't want a cesarean section. And at that point, I gave her options. As long as mom and baby are safe, what are the options? Did you want to continue to see, but she wasn't effectively pushing. Baby wasn't really as descended as we'd like. And she wasn't relaxed. She was getting more anxious. And I think she was getting concerned that this is not happening. I should be here now. And my baby should be in my arms, and what's going on. And it was only kind of taking her backward. Just anxiety was kind of rising up in a way that was just not helping her progress. And I gave her choice. I said, let's think about it, talk about it, whatever you want to do. If you're safe, the baby's safe, we still have the option of observing. Let's do a practice push. Let's see maybe different environments. And then she got to the point for herself. She goes, I haven't slept in at least a day. I haven't really eaten or rested. I'm just maybe a little bit. She goes, and my anxiety's sure. And I said, okay, how would you like us to proceed? Because the only way I can give you any rest is through some form of, relief. And it could be in the form of an epidural. And she goes, well, as long as I don't get a C-section. I said, okay, but be clear. I won't guarantee that you can't get a C-section, that you won't get a C-section. I'm going to do that. But we're going to try to exhaust all the possibilities of reducing that level of intervention. So let's take the next step. As you requested, let's go to the epidural. Okay, so we did that. And it took some time to get her relaxed, because it took time to get her adequately or optimized, when it came to the epidural, or still not getting good pain relief. By the time she did, she probably got a nap, but then she had other people in her ear. Before I even walked into her room, she was already built up to, you've been in this position for so long, and it's very concerning that you've been fully dilated for this long, and the chances of your hemorrhage risk is high, and you are better off having a C-section. Now, this got into her ear before I even got into the room. So by the time I'm being called in, and mind you, we did all the positions, spinning babies, peanut ball, anything we could do to try to help the descent and keep her relaxed. And she was starting to feel more pressure, but now she's anxiety-ridden because she's feeling the pressure, not realizing what she's feeling was normal at this point. But she's so up there because someone explained to her that you've just been there at this stage for too long. It's unlikely that you're going to have natural delivery. And I walked in the room. She goes, Dr. Bennington, I'm ready. Let's just go into the C-section. I'm like, I'm sorry. Can you call the section? Because I just walked into the room.
Yeah.
And, how are we here? And she goes, I was told that it was just too, and she's repeating back everything to me that someone said to her. So she's already in a place of, I'm going to fail. It's very likely I'm going to have a vaginal. I'm just ready to go. I just want a healthy baby. And mind you, there was nothing going on with the baby to be concerning at this time, but she was already there. And I'm like, you know what? We started this race, and you somehow got 1,000 miles down the road ahead of me, and I'm still at the tape. I barely crossed it. We didn't even break the tape. I said, can we do a few things? I said, I haven't told you that we are in a C-section mode. We haven't examined you. I haven't even assessed if the baby has come down, and I haven't even done a practice push with you to see if you could move that baby. I said, can we try those things first, and then we can reevaluate? She said, okay. She pushed the baby out within an hour. She had a vaginal delivery. And she goes, I can't believe it. I can't believe it. But I'm like, in that moment, I'm sitting here going, oh my God, she has all this noise. Someone just fed it, and watered it, planted a seed, grew, and then planted it. She was gone before I even walked in the door. That negative talk can start with a simple, it's kind of, people can plant those seeds of doubt, which can grow into the anxiety, can grow into fears. And so when you're talking about crushing, you can crush it. You don't have to be as aggressive as I can be sometimes, but you can try like negative talk.
No, it's true.
I try to be, hey, let's...
I think we see that. We see that a lot here, especially if it's like grandparents. grandparents are like my famous ones that are like, she still hasn't delivered. We've been here for like 10 hours and it's normal, you know, and I think you should go to the hospital. And it's like, well, you're going to be over there the same amount of time if you were there. If not, like I don't. But yeah, I feel the same way as you, Doc. Like, I feel like you should shut it down. And especially when you are talking to your provider, and just confirm with your provider, right? Like, hey, this is a plan. I feel maybe this, and what are my options, and have a clear understanding with your provider.
For me, it's also reminding them what they've been doing well already. And particularly when it comes to, the transition period when everybody wants to, quote, give up. And to your point, you mentioned she's already looking down past the road to all these other things. And it's like, let's stay present in the moment. Let's take one wave at a time. You got through the last one. Let's just get through this one. Let's not think about how many we have to have going forward, how many we need to get to have this baby. Because somebody literally asked me, how many more contractions?
That's what she likes in the beginning. Yeah, beginning of the process. We should go and goes, how much longer do you think I have, Dr. Pemberton? How many push-ups? I said, I don't have my degree from Harry Potter University.
Yeah, I don't want you to notice that. So what we can do is do what you're already doing. And you're doing that well.
Yes.
Yeah. And that's what
keep the encouragement is that moment.
Encouragement and all of that stuff happens. And then it just passes because transition passes. And then they get the urge to start pushing. And all of a sudden, the beautiful endorphins and adrenaline comes in. And everybody's like focused and doing it.
Yeah. Okay. I think the greatest thing, and this was because I felt like when I was delivering and I was pushing, I don't think I was pushing effectively. And Doc brought out the mirror. And I didn't know what that was. And she was like, look at yourself. This is how, and then we did practice with it. That's how I'm like, oh, okay, now I know what I'm doing. And that like boosts my confidence so much. When I'm like, now I know
the progress.
Exactly.
You were not just floating in the water. You're literally swimming. You're doing some work. Yeah, that's what makes a difference.
Yeah, some people go, I don't want to see that. I said, okay, it's not World War III down here.
Yes,
so I understand. But some of them feel it, or sometimes I make them touch them at the head, go, that's real. I said, that's you. You just did that. That head is coming down because of you. And they start panicking. Just the pressure. So repeat after me.
Yeah.
So pressure is normal. You got this.
My son's Nero. I was just like, whatever, I'm going to just give it what I got. And that's when he came out. I was like, I tear, whatever. And that attitude of like, I'm just going to give it all I got was really the push that I needed to get. Like internally, after the Martin episode, I'm talking to Doc about, I was like out of it. I'm like, we just kidding. I was out of it.
Yeah.
I was so tired.
We were talking about a Martin Lawrence episode with the baby shooting out.
Yeah, I was like, this reminds me of a Martin episode where they were like, it was a baby that was coming out, and then Doc is like, what? How high are you? I'm laughing by myself about this episode.
You have to have your moment. It's fun.
It really, you gotta check back into reality. I'm like, all right, now I'm gonna you know what? Whatever. Just go. Like, what's the worst that can happen? Just
go to have a baby.
Yeah, exactly. How do we help women take harness in their power? I feel like that last conversation was also kind of
wow. I mean, you really have to just let them understand. And I know this sounds all cheesy, but like, what was your body made for? Right? Like, we're real comfortable with knowing what our heart does. We know what our lungs do. We know those things are kind of going on all part. Here's your uterus. What is it for?
Yeah.
Right? What are we here for? What's it doing? And just looking at that and, and everybody after birth, there's always somebody who will say to me, oh my God, I couldn't have done it without you. And I go, you could have. I just brought out the birthing warrior.
Yeah.
That's all. So,
And I also feel like when you understand that your birth isn't going to look like her birth, and you make it your own, I feel like when you have the power.
Right.
So
That's true.
because I can't have this vision of what my birth looked like based off of a movie that I just saw last week. And then I'm like, it should be just like this. And now I'm upsetting myself when it's not looking like that.
or back to her other story about the power of suggestion, right? Taking that away from you, saying, oh, it looks like you're going to have an epidural, looks like you're going to have a C-section, if those aren't things that you wanted or needed in the moment. And you can't let somebody in your head if you know
Yeah.
what your body is capable of doing. So for me, it's trust. It's trust.
And also, it's also having support with you that can be your advocate.
Yeah. Like,
Because that having an advocate at that moment helps. And or having your midwife like, hey, like this C-section, what are they? And you're like, no.
yeah, they just got to sound like up again.
Yeah.
I'll see you later.
Go to sleep. Yeah. You know, or your partner knowing your plan, they're like, no, we're not, we're going to talk to a doctor and we'll talk to you. Yeah.
Especially if it's not your doctor.
Yes. Yeah.
yes, that's true.
Right? If it's, somebody else coming in just because, so they want to come in and do whatever, or it's the culture. That's cool. But if you don't know me, you don't know what I want.
And if you haven't asked,
This. Like I said, stage left.
yes, exactly.
Is this the same question? How do you achieve power and equity in birth? And equity in birth, is that?
Equity, that's going
No, that's a
deep into the weeds.
different conversation. Equity is more like about access to everything, like access to the birth center, access to doulas, access to
Insurance, access to
quality care,
Why don't you feel like other doctors' office give you as much support or just even education or knowledge? Like just give you all of the resources you can get to have a successful either interventional birth or just, let me tell you, honestly, I haven't heard of a birth plan until I came here. And I've worked in many doctors' offices.
Yeah, I think it's time and culture, right? If you don't know what you don't know. And if your culture is not set up for normal, natural, physiologic birth, why are we going to talk about a birth plan? And if you do bring a birth plan in my office, I'm going to look at it as like, why are you telling me how to do my job? Mm-hmm. So it's definitely culture and, people who are following evidence and don't. People who are working in the space of anecdotal information, like, well, in my practice, we do this, and this. Yeah. Right? Like there's a lot of all of that stuff that's happening in hospitals as well.
Well, you do get a lot of those doctors that are like, me doctor, you patient. And it's like, I can't say anything because you know more than me, or, and that's the effect you get.
As a doula, obviously, I've worked with hundreds of other doctors within the state of New Jersey and out. And it's always interesting to me to see how much ego plays into someone just asking a simple question. Like, oh, okay, so if I'm going to be induced, can I be induced this way instead of that way? Well, what do you know about it? Mm-hmm. How, what does it matter? You're getting induced. What do you mean, what does it matter? It's my body, it's her, or
this is how they do it here.
Well, so it's not at the Michael Jordan time. So they start singing, this is how we do it. Immediately. And they come in the hospitals, they come in the offices. They're like, oh, well, this is not, and this happened. Or this the policy. This is just our policy. This is how we do it. I'm like, I mean, it's nothing wrong with having policy. We all have to have policies. That's what comes with, whether it be ACNM and ACOG and donor. We all have to have policies. But we're talking about asking questions, and we're talking about versus questioning. And when you talk about questioning, Yes, there's a little bit, as you say, there's got to be some level of bravado or ego involved where you're going, are you questioning what I've been at this? But you don't have to give your recipe.
Yeah.
It's a question. And if you feel like you have to get caught up in your feelings every time a patient asks a question that's outside of the realm of what, then that concerns the relationship a little bit as well, because then it becomes a dictation, not a discussion. I'm going to dictate to you how this is going to go. Okay, versus, okay, this is what we usually do. Okay, but what are your understandings of it? What's your expectations? And what were your desires when it came to it? Because again, it's like marrying the two. The expectation versus reality. We recognize Scott, men plans, God laughs, but that's understandable. But I always tell people, come in with an understanding of what you want. And this is something that Michelle teaches in her classes all the time.
Yes.
You may not be like Microsoft Word and typed in this town of spicy folder, but and here you go. Most people just look at it and go, yeah.
Yeah.
Versus actually having a discussion. And sometimes the question they ask, again, he's did not practice. Do you do delayed cord clamping? Yeah, absolutely. And if they say, well, if I have a C-section, could my husband or partner kind of trim the cord? And I'll tell them, we can definitely do that. And I'll even clamp the cord long enough where they can do that. But it's C-section, it's a sterile field. So you may not be able to reach over and do it because, again, I got to keep my field sterile for you so that no infection is introduced. But we can do that when the baby is off the field. People do delayed cord clamping. We still on but and it's just basic questions, but you're just giving them the information because you need to also, they come in with anxieties and fears. And especially now these days, how is it going to be I'm scared about what could happen in the hospital and I want to be okay and I want to be safe and I want to be able to say I checked out as much as I've checked into the hospital to have this baby. I want me to be healthy, safe, and so on with my baby. What is wrong with demystifying?
Do you feel like some doctors are just intimidated with patients who have knowledge, who have like the education or just want to know exactly?
I'm not even sure if it's a level of intimidation either. It just goes back to ego and bravado. Like I literally, there's some times when I will visit, with clients because they feel intimidated by having any kind of conversation with their doctor. So I'll go in, we'll sit down, and we'll talk about it. There was a sign in this person's office that literally was like, your Google question does not trump my local brain assignment that integrate. Wow. And, so it was like, don't come to me with your Google questions. And then there was another one that was like, we're the top tier doctors of blank, 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 and we know best. So we don't work with Douglas. So it's almost kind of like this very, we don't want you to have an independent thought.
Yeah.
We want you to just align and get with the program and be in uniform.
Number 26.
Exactly what we're doing. So we can just roll out here. And I, for some people, they like that regimented stuff, and other people, cannot function in that kind of space at all. It doesn't feel. I mean, let's go back to what we're talking about. We're talking about bringing life into this world. Why does that be like? Needs to be like take a number. Like I'm at the deli getting my salami. Like what?
I like to have 8 pounds at there. Salami over there.
Well,
thinly sliced.
No, like slice 19 inches. Blue-eyed, blonde hair. Like what are they doing?
Yeah.
We're gonna name her Jackie. It's an assembly line.
Yeah.
And we have to go back to looking at the individual and treating people like people. It's such of a thing. So it starts. What was it called? Bedside manner. What? I don't even know if people would even know what that is anymore.
Bedside manner or matter?
Manner. Bedside manner.
Oh, yeah.
Like just, having an actual affect of. I've been at births where the doctor has not even looked at the patient, said anything to the patient, never even
And now you're going to be in one of the most
Intimate parts of
intimate parts of my body.
or anything, and then there's the baby. Congratulations. And what are we, robots?
Yeah.
Like, it was just like, am I in an AI movie right now? I think AI.
Hi, how are you doing? Hi, how are you?
AI would say, I want to be more human. And then you're like, yeah, be more human.
That was a baby. That was beautiful. There was no emotion.
Oh, man.
All. And to me, you need to stop doing that job. Like,
Yeah.
if you have tapped out and are touched out and are burned out and whatever it is that you can't even have a modicum of burnout is emotion, and I understand with those individuals who just brought birth into this world.
Which is one of the most beautiful times in their lives, you know?
Do something else with your brilliant mind. Do something else.
Yeah. Like retire. No, I was kidding. Anywho, I love talking to you ladies. That was a pleasure.
Anyhow, I thought you said anyhow.
Like, anyhow, and peace.
Thank you, ladies.